Welcome to Module 5 of our Direct Care Employee Training, Safety, Hazard Communication, and Safety Data Sheets. As a direct care worker, your safety is just as important as the safety of the patients you serve. The home environment can present hazards that vary widely from patient to patient, and every employee must be equipped to recognize, manage, and respond to risks appropriately. Hazard communication is a required federal standard designed to protect you from chemical exposure and other environmental hazards. Under OSHA's Hazard Communication Standard, often called Right to Know, you have the legal right to understand the chemicals you may encounter while performing your duties. Cleaning products, disinfectants, medications, aerosol sprays, sharps disinfectants, biological contaminants, oxygen tanks and related equipment, laundry chemicals, personal hygiene products that contain irritants. Your role is to know how to identify, handle, store, and report these hazards correctly. This module will help you understand how to stay safe, how to read labels, and how to use safety data sheets, which contain essential information about chemical safety.
OSHA requires all employers to protect workers from hazardous chemicals or materials. This includes providing training, labels, protective equipment, and access to safety data sheets.
The Hazard Communication Standard has 5 major components. Written Hazard Communication Program. Nobleman Care Services maintains a formal written plan outlining safety procedures, storage rules, and documentation requirements. Chemical inventory. All chemicals used in the office and in patient care are listed, labeled, and tracked. Labels and warnings. Every chemical must be clearly labeled with its contents, hazards, and precautions. Safety data sheets, SDS. These documents explain each chemical's hazards and the protective measures employees must follow.
Employee training. You receive training upon hire and annually, so you know how to manage chemical-related risks.
This standard gives you the right to access safety information at any time. You must be able to recognize the hazards associated with the materials you work with and know how to protect yourself and others. A safety data sheet is a standardized document that provides crucial information about chemical hazards. Every chemical used in patient care or in the workplace must have an SDS available for employees to review. OSHA requires all SDS documents to follow a 16-section format which includes identification, product name, manufacturer, emergency phone numbers, hazards identification, all physical and health hazards associated with the chemical composition, ingredients, chemical components and concentrations, first aid measures, what to do in case of exposure, splashes, inhalation, or ingestion, firefighting measures, how to respond if the chemical causes or is involved in a fire, accidental release measures, steps to take after a spill, including safe cleanup methods, handling and storage, safe practices, storage conditions, and incompatibilities, exposure controls, PPE, specific protective equipment and ventilation needed, physical and chemical properties, appearance, odor, boiling point, flash point, etc., stability and reactivity, chemical stability and conditions to avoid toxicological information, health effects from exposure 12 to 15, environmental, disposal, transportation, and regulatory information. Other information including SDS version and revision date. SDS documents empower you to handle chemicals safely by explaining exactly what can go wrong and how to prevent it. Whether you're exposed to a chemical spill, need to disinfect equipment, or are confronted with an unfamiliar product in a patient's home, the SDS provides the essential guidance. In home care, chemical hazards don't just come from medical supplies, they often come from the household itself. Every home is different, so you may encounter strong cleaning agents, bleach mixtures, ammonia-based products, air fresheners or aerosols, over-the-counter medications, pesticides, solvents in garages or sheds, glues, paints, or craft chemicals, nail polish remover, oxygen tanks and concentrators, soiled linens containing bodily fluids, patients' personal hygiene products with irritants. You must never mix chemical products as dangerous reactions can occur. For example, mixing bleach with ammonia produces toxic fumes that can cause respiratory distress. If you encounter a chemical you are unfamiliar with, do not use it until you've consulted the SDS or contacted the administrator for clarification. Your safety comes first. Your role in maintaining a safe environment is essential. Here are your responsibilities under OSHA's Hazard Communication Standard. Always read labels before using any chemical. Use the correct PPE when handling disinfectants or other products. Do not use chemicals from a patient's home unless approved by agency policy. Report missing labels immediately. A product without a label is unsafe to use. Store chemicals safely, away from heat, flames, or incompatible materials. Never mix chemicals without explicit approval. Avoid inhaling fumes, especially in poorly ventilated areas. Keep chemicals out of reach of children and vulnerable adults in the home. Employees must follow all safety protocols exactly. Shortcuts can lead to injury, illness, or hazardous exposure. If at any time you feel unsafe, you must stop immediately and contact your supervisor. Personal protective equipment is essential when working with chemicals or potentially hazardous materials. When handling disinfectants, soiled linens, contaminated waste, or any product with strong fumes or irritants, you must use the proper PPE, which may include disposable gloves, eye protection, such as goggles or a face shield, masks to protect from fumes or aerosols, gowns or aprons to protect your clothing, proper ventilation or opening windows. If chemical splashes occur, rinse the affected area with water immediately. Remove contaminated clothing. Follow the SDS first aid instructions. Contact your supervisor right away. Seek medical evaluation if irritation persists. The safest environment is one where PPE is used consistently, not only when you think it might be necessary, but whenever a potential hazard exists. In addition to chemical hazards, employees must also understand biological hazards. Biological hazards include exposure to blood, bodily fluids, sharps, contaminated linens, and infectious materials. These hazards require strict adherence to OSHA's bloodborne pathogen standard, discussed in Module 2, and include proper sharps disposal, avoiding recapping needles, using universal precautions at all times, wearing appropriate PPE, proper waste disposal, using biohazard bags, immediate reporting of exposure incidents. Following post-exposure evaluation steps. Failure to follow biological safety standards puts both employees and patients at risk. When in doubt, assume that a substance is potentially infectious and follow universal precautions. Reporting hazards promptly helps protect everyone. If you notice a chemical stored improperly, a strong chemical odor in the patient's home, missing or unreadable labels, damaged or leaking containers, unsafe disposal practices, malfunctioning equipment, unusual patient reactions to fumes or products, a spill involving chemicals or bodily fluids, you must immediately stop using the product, remove yourself and the patient from danger, contact your supervisor or administrator. Document the incident, follow instructions for cleanup or containment. Your timely action can prevent injury, illness, and legal violations. Hazard communication is a shared responsibility. In summary, hazard communication is an essential part of home care safety. Understanding chemical hazards, using PPE correctly, reading labels, and knowing how to access safety data sheets ensures that you can work safely and confidently in any environment. Your right to know under OSHA empowers you to protect yourself. If you are ever unsure about a chemical or safety procedure, do not proceed until you receive clarification. Remember, safety is not optional. It is a core part of providing high-quality, responsible home care.